If you've been told your joint pain is just wear and tear, then in this video I'm going to take you through what really works for osteoarthritis and importantly, what doesn't. Hi there, it's Luke from Genuine Physio, and this channel is all about keeping over 40s happy and healthy. Now, the notion that osteoarthritis is just wear and tear is a completely outdated narrative. But unfortunately, it is still a very present narrative in society these days. Despicably, it's often even given to you as a diagnosis for osteoarthritis. So you just have wear and tear. That is not a diagnosis. That is a really old school way of describing what is happening to your affected joint. We now know that osteoarthritis is actually a pretty complex condition affected by lots of different factors, ranging from genetics to previous history of injury to underlying comorbidities. We know that women are more likely to get osteoarthritis than men. We think there's quite a significant hormonal factor at play. We know that your BMI, your weight, is a factor. Your nutrition in conjunction with that is also a factor. How much exercise you do is a factor. If you have joint pain, you may even find that the weather changes your symptoms. So there's all of these different things at play, and they all kind of work together either for or against you to end up leading to joint pain symptoms. So what works for osteoarthritis? Now, one of the fundamental problems with telling somebody they have wear and tear is that if you then go on to tell them that exercise is a good idea, then it instills the fear of God into them because they're worried about doing more harm or damage to their joint. And that's completely understandable. If we are sowing the seed that using a joint more is going to cause further change and degradation to the joint, then it's completely understandable that people are not going to want to exercise. So we need to change the narrative, and we need to explain why exercise can be helpful. And there are a number of different types of exercise that can help your joint symptoms, and we're going to discuss them now. Cardiovascular exercise can be helpful. So this includes things like walking, jogging if you can, cycling either on a static bike or outdoors, using a rowing machine, using a cross trainer in a gym, or if you're lucky enough to have one at home, and swimming and aquarobic. So this type of exercise is designed to raise your heart rate, get you a bit flushed in the face, get a bit of a sweat on, burn some calories. Now, why are these things helpful for osteoarthritis? So you are a system made up of lots of different systems. So we've already spoken about hormones, but your hormonal system is linked to your immune system. Your immune system is linked to your musculoskeletal system, so your muscles and bone system. Your cardiovascular system is also linked. So all of these systems are linked. They don't work independently of each other. They work together all of the time. And when you get your cardiovascular system working, that has a lot of positive effects on all of the other systems. So one thing it does is release anti-inflammatory chemicals in your body. So you've got naturally occurring pain relief in your body that only is produced if you move. You've got endogenous opioids, so those happy hormones that are produced, which are associated with pain relief. We know that it's good for mental health, and we know that poor mental health is more likely to increase pain. We know that it can help with sleep. We know that poor sleep is likely to increase pain. It also improves motivation and energy levels, not to mention that these are all things that you can do with some social aspect, which we know is also really good for pain. Another type of exercise is going to be stretching. So if you do have a stiff joint, a joint that you don't feel is moving very well, let's say your knee, it might be that doing some stretches to try and get your knee a bit straighter, or some stretches to try and get your knee a bit more bent, is going to help get you a bit more range back, which could then translate into walking a bit better and without a limp, and that can also help with pain relief. Balance is also a really good idea to incorporate into your exercise program, because as we get older, our balance decreases. If you have joint pain and actually you've spent a period of time doing less, your balance is going to decrease again. And the last thing that you want to do is have a fall, because Falling is associated with decreased confidence, and then we're back into this vicious cycle of doing slightly less to avoid falling, but actually doing that for a prolonged period of time is not helpful. So balance is another thing that you may want to consider in terms of exercise for your joint symptoms. And the most important type of exercise is strength exercise. So trying to build up, again, if we talk about the knee, your quadricep strength, so that's the muscle at the front of the knee, your hamstring strength, your glute strength, is absolutely vital if you want to optimize your joint health. And regardless of whether you have joint pain or not, we should all be completing around 3 sessions of strength exercise every week in order to negate the things that happen to our body as we naturally get older. And it's also the type of exercise that I see people do wrong most. So there's a lot of nuance to strength exercise, there's a lot of things to get right, there's a lots of variables to play around with, and they are difficult to navigate if you have pain. Now, I have put quite a few videos together on the YouTube channel for strength exercises, particularly for knee and hip osteoarthritis, so feel free to take a look at those at your leisure, and I'll pop a link to a couple of those videos in the description below. Another thing that we know works really well if you have joint pain is weight loss. And it's really important that you understand why, and I appreciate that if it is something you've tried in the past, it can be a real challenge, but people often don't understand why weight loss is so important. Now, obviously, we've got the biomechanical effect of having more weight on our joints. Most people get that. The heavier you are, the more load you've got going through your joint. If you've got a sore, inflamed joint, it's not going to help. But the thing that people don't talk about very much at all is the fact that if you are overweight, if you have a high BMI, again, going back to the systems that we were talking about earlier, a byproduct of how your body breaks down fat is inflammation. So if you are overweight, you've got more inflammation moving around your system all of the time. And we can try and do all of these pain relieving adjuncts for your joint pain. We can try and reduce inflammation, but actually if you've got consistent low level inflammation moving around your system all of the time, it's going to go a little way to undoing the things that we're trying to do to facilitate improvement. So it's this low level inflammation that occurs when you're overweight that is what we're trying to reduce by losing some weight. Another thing that we know works really well if you have osteoarthritis is education and advice. You need to have a good understanding of your condition if you want to manage it well long term. And quite honestly, one of the most profound things that I have in my toolbox when it comes to helping people with osteoarthritis, and I see tens of people a week who have osteoarthritis, is reassurance, is making you aware that there are lots of things that you can do to help. There's such a negative stigma societally around osteoarthritis. It's a condition that's just gradually going to get worse with time. There's nothing you can do about it. It's inevitable as you age. None of those things are true. So reassurance is really, really powerful. I will often say to patients that come to me and they say, what should I be doing? What shouldn't I be doing? There's nothing that you're not allowed to do. So there are no black and white rules when it comes to managing osteoarthritis. How can there be? There are millions of people in the world with osteoarthritis. So how can we advise black and white uniform things to everybody? It's a spectrum of severity. So you could have an osteoarthritic knee and be able to play 2 hours of tennis and have a little bit of stiffness the next day, or you could have a severely arthritic knee, struggle to weight bear, have significant night pain and need a knee replacement. So clearly where you are on that spectrum of severity is going to dictate what you should and shouldn't be doing, and that's why it's important that you have a bespoke, personalised, tailored approach to your care. But definitely reassurance, education and advice is really powerful when it comes to managing your joint symptoms. Another thing that's really important if you have osteoarthritis is to have some pain management strategies so that you can plan. And going back to what I was saying a minute ago with regards to education and advice, part of that is discussing flare-ups. So flare-ups are a normal part, unfortunately, of how osteoarthritis behaves, and having some things in your toolbox that you can use to lean on during a not so good period is really helpful. So thinking about things like pain relief. It might be oral pain relief, it might be topical gels or creams. It might be a splint if you've got arthritis in your thumb, or a tubi grip if you've got arthritis in your knee. It might be some heat, it might be some ice, it might even be a walking aid. There are lots of different pain management strategies, so it's important that you have a discussion with someone so you know what your options are and what you can lean on during a not so good period. Now let's talk through 3 things that generally do not work very well if you have osteoarthritis. The first one, which is my pet hate, is being given a generic sheet of exercises and left to get on with it. And unfortunately, this is something that I hear all of the time in clinic from patients. And the reason this doesn't work is because of what I was saying earlier in relation to it is a massive spectrum of severity. All of your experiences of osteoarthritis are going to be different. They're going to affect your day-to-day life very differently. Some of you are going to have a very high level of function, some of you are going to have a not so high level of function. And that is why a one-size-fits-all exercise program generally doesn't work. And it's really, really frustrating when I see patients and I'm doing second or third opinion work and their perception is that exercises don't work for them or physiotherapy hasn't worked for them. And it's actually just a case that the exercise wasn't tailored, it wasn't bespoke, and therefore it wasn't the right exercise at the time. But fundamentally, there are very, very few instances where I see people with osteoarthritis and there's no exercise that they can do at all. So it's really important that you have a bespoke, personalised and tailored approach to your exercise program. The second mistake that you can make is just avoiding exercise or movement completely. It's a slippery slope of gradually just doing less and less. All this leads to is more problems. You get weaker, you get stiffer, generally pain increases, and your general health decreases. Your heart gets less fit, your lungs get less fit, and you increase your risk of getting lots of other stuff that you don't want. So one of the real positives about the treatment approach that we've discussed for osteoarthritis is that it's actually going to have a massively positive effect on any other health condition that you could possibly think about. So it's really good for just general health as well. The third mistake that people make is thinking that surgery is inevitable. It's just going to happen regardless of the things that you do. If you do have that mindset, you have straight away significantly increased your chance of having surgery, possibly surgery that you may not need. Now, certainly a joint replacement is an appropriate surgery for many people, but actually the majority of people are managing osteoarthritis without invasive intervention like injections and surgery. And mindset is a massive thing when it comes to trying to manage your symptoms and optimizing the health of your joint long term. So just to recap, the term wear and tear is inaccurate and unhelpful. It's unhelpful because we know one of the best things that you can do is exercise in order to optimize your long-term joint health, not just your joint health, but your general health as well. Weight loss, if appropriate, is a good idea. Make sure you have some pain management strategies so that you can lean into those on those not so good days, and education and advice is really important. Remember, knowledge is power. Things that are not so good for joint pain is a negative mindset, thinking that surgery is inevitable. Stopping activity and exercise is a slippery slope to just becoming generally less healthy and your joint pain probably getting worse, not better. And then the last thing was the generic sheet of exercise. That's a one-size-fits-all approach. It's not personalised, it's not bespoke, and therefore it's less likely to help. On that note, if you would like some more one-on-one help, some personalised help, then I do see a very small number of patients one-to-one each week. You can find information in the description below about how you can do that, and there are lots of osteoarthritis exercise videos on the YouTube channel that you can have a look at your leisure, and I really hope you find those helpful. I really hope you found that helpful. If you did, please do like the video and subscribe to the channel so you don't miss any more over 40s health related content that I bring out most weeks. It also means more people will see the content that you found helpful. And whilst you're doing that, I'll see you in the next one.